So my name is Raine Rackley. I'm a physical therapist at Fort Loudon Medical Center, or TOC. I think I've probably seen at least one of you I know as a patient here recently. I just started at TOC back in October, and I'm certified in TPI, which is the Titleist Performance Institute, and it's an injury prevention program for golfers. So that's kind of what everybody will be talking about today.
All right, let me go ahead. We're going to go ahead and get her screen shared so you all can see what she's seeing. I will say this, there is a portion of this program where we will talk about a home exercise program and a slideshow. If you want that sent to your personal email, go ahead and send your email to Raine. So right now it's set in the chat box, it's sent to everybody. If you send the email, if you send your personal email to Raine, we will make sure that you get all the information sent to you. So let's go ahead.
We'll get started with it.
Here we go.
All righty.
Let's change this.
Yeah, there we go.
Okay.
All righty, perfect. Okay, so let's kind of get started with everything. So this is injury prevention in golf. Quick little disclaimer, we will be covering some exercises in this session today. All of these exercises are specifically for injury prevention in particular. So if you have any type of pain, any type of discomfort, in general, or while performing these exercises, 100% I would recommend let a medical professional check you out, like a physical therapist or an athletic trainer like Gina. Make sure someone is assessing that, so you make sure that you're not continuing to do something that might not be beneficial for you. So we'll get started with everything. All right, so this is a little bit about me, a little bit about what I've been doing for the past little bit. I'm a graduate of the University of Tennessee at Chattanooga. I completed a bachelor's degree there for 4 years in health and human performance. Next, I was at Belmont University for 3 years to get my doctorate in physical therapy. And then after I completed that in August, I started working, like I said, at TOC in Lenoir City. A couple of other things that I've been working on in that meantime is I have my Titleist Performance Institute certification. I'm a level 1 certified in that as of January 2020. And essentially what that does is it gives me the ability to assess particular movements that are required of the body in the golf swing. I'm also certified in the Selective Functional Movement Assessment. So if there's any particular problems in certain points in the body, I can use different points of exercises and assess where the problem is coming from. Another thing I'm certified in and haven't been using very much recently, but hopefully we'll be getting back into that, is a dry needling certification. With that, what we use is similar to acupuncture needles. We use trigger point dry needling to help release certain things in the muscles if there's any trigger points built up due to pain, things like that. So a little bit about Titleist Performance if y'all are not familiar with this. They're an educational organization that's dedicated to studying how the human body functions in relation to the golf swing. So their belief is that anyone can perform a golf swing, but not everyone is going to swing in the exact same way. But there's one way that every player can swing efficiently. And our job with that, with our screening process, is to know what types of physical limitations you have in either mobility or instability that will affect the golf swing, whether that's to help you swing better or to help you reduce the risk for injury. So a couple things we'll talk about after this is why we get injured in the first place. The first thing that most people think of when they get injured is impact and trauma. So a fall, something hits you, anything like that. But impact and trauma can also come from various other things. It can come from end range of motion in a joint, and specifically like say the back during the golf swing. If you have a very tight twisting, torquing motion, the end range and impact of trauma of the joints on each other can actually cause trauma and pain in that area. So it can be outside forces, impact or trauma, or it can also be internal forces from the body itself. Another one we see very, very commonly is overuse and fatigue of those muscles. So if you are not 100% a regular golfer, or say maybe you play 9 holes and then you up it to 18 for the day, sometimes we can see overuse injuries for that because muscles or tendons are strained more than they are capable of handling at that time. So we see that quite frequently. Even things that are not related to the golf swing, walking long distances, at hills, things like that, we'll often see injuries caused from things like that as well. Another thing we can often see is an inadequate warm-up. And sometimes that comes from not warming up in general or not knowing the best way to warm up in the first place that can lead to injury down the road. So perhaps you've been doing some static stretches, but the golf swing is very functional and very dynamic and requires a lot of strength in the body. And if you haven't been working proper muscles, then the warm-up you're doing might not be able to get you to the point that you need before you go up and tee up for the first hole. Other things that we see very, very common is poor posture and poor endurance of postural muscles. So say if we sit constantly during the day and we're kind of head forward like this, kind of rounded shoulders, we can actually see decreased endurance in the postural muscles up behind the back, in the lower spine, in the core, different things like that. If those muscles are not strong and are not able to withstand the postural changes, which we see quite frequently in golf, then we can have a little bit of a problem there, and it can lead to pain because they're not able to hold up to that type of activity. Last thing I want to say, and this one kind of encompasses everything as far as impact and trauma, overuse, warm-up, posture. A lot of these things and a lot of problems that we'll come across is due to muscle imbalances. And when I say a muscle imbalance, I'm talking about tightness in particular muscles and weakness in others. Now, if these muscles are improperly balanced in this way, then it can lead to excess pain because the forces that we require of ourselves during the golf swing or during walking long distances on the golf course, then those muscles are not able to withstand the force that they need, because some need to be stronger and some need to be able to lengthen out and stretch more to be able to handle those forces. So something that y'all heard me mention just momentarily ago is the concept of mobility versus stability. And I kind of wanted to break that down a little bit because it's kind of the focus of all the different exercises and all the things that we're going to be talking about today. So mobility itself is the ability of the body's joints and muscles to move throughout their full range of motion in a stretch and shortened cycle. So say for an elbow, full mobility would be being able to bend and completely straighten that joint. That would be full mobility of that elbow. Now, stability is a little bit of a different concept, but very, very related to mobility. It's the ability of the body to remain aligned in the presence of outside forces through balance, strength, muscular endurance, things like that. So it's how the body holds up to outside forces in relation to mobility. So say if I have a heavy weight in my arm, am I able to fully move through that same motion as I do when I don't have an outside load applied to that body part? So concept of mobility and stability, super, super important. Stability is incredibly required to be able to produce a healthy golf swing, but the concept that we want to understand, you have to have appropriate mobility of the body first before you can achieve the control, strength, and stability of the body afterwards. You can't lift a weight if you can't bend your elbow in the first place. So next thing we'll talk about is a couple of the issues that we see very commonly in the lumbar spine or the lower back, as well as the hip. First thing that we see quite frequently is disc issues. I have a ton of patients that come in with issues and problems with this every single day. The disc is essentially a shock absorber that sits right in between the different vertebrae in the back. If you'll see on the screen right here, you'll see those different square boxes. Those are the vertebrae. The disc sits right in between that. Now, if there's excess forces and outside forces, which can be from the body itself or can be from lifting, carrying a golf bag, even swinging with the effect of all the torque from the swing, a lot of times those discs will actually protrude out of the way from those vertebrae. Now, when that disc protrudes, it sits into a ton of different soft tissue structures that surrounds that. Muscles, nerves, tendons, ligaments, tons of different things can be compressed where they normally are not. So if you have a disc issue, it's really, really important, especially to find the exact type of movement that you need to restore that issue and to essentially realign the disc within the back. If you feel that you have a problem with this, if there are certain movements that are really, really difficult, I would highly recommend seeing either an athletic trainer like Gina or a physical therapist like myself, because we are very well trained in how this repositioning will work to get your body back to where it needs to be so that you can move through that full amount of motion. Another thing that we see super commonly is stenosis issues. And what that is an extended position of the back, which causes the joints in the back to be compressed back through in this area. Now, kind of how I said before, if the disc protrudes out to the back with a disc issue, it'll compress on all the soft tissues. With a stenosis issue, those are the joints itself compressing back on all those soft tissues. So both of those will cause impact and trauma to those areas and increase pain. Another thing I want to touch on as well is muscle activation issues themselves. If you have strong or tight muscles in certain areas and weaker muscles in others, a lot of the times we're going to see increased pain in the back. And we'll talk about this a little bit later on in the presentation as well. If you don't have good abdominal control and you have really, really tight extensors in your lower back, so really, really tight muscles in your lower back, a lot of the time we can see excess pain just from the tension of the muscles themselves. Think of them as being almost sore and fatigued from having to work really, really hard to keep you in that position. So next thing we'll talk about is the hip itself. And the reason we're talking about the lower back and the hip themselves is because both of them kind of interplay together. Typically, if you have a back issue, most commonly you're going to have problems in the hip below. Very frequently, if you have a hip problem, you'll most likely see problems in the back above. A couple of things that we see in the hip is osteoarthritis. It's very, very common across all different populations. I see it in just about anyone that I treat. But I want to kind of let y'all know that osteoarthritis itself does not mean that you're going to have pain. It's really about how much inflammation and swelling that is within the joint. If that continues to increase and it continues to get inflamed, that's when pain starts coming about. The simple fact of having the osteoarthritis does not mean that that's exactly what the pain is coming from. And there's a lot of different exercises to improve the strength and mobility of the hip and of any joint in the body that this happens to, that can increase all the forces around that area and keep it nice and stable so you don't have that problem anymore. Another one that I wanted to talk about was impingement of the hip. And this one kind of goes along with the labrum of the hip. Now, the labrum is kind of like a small capsule that sits around the hip joint. So the acetabulum that sits within the pelvis, and then the hip joint that sits right into it right here. And the labrum kind of encapsulates all of that and provides negative pressure, which keeps that hip joint in place. So if you have a small tear in that labrum from impact, trauma, excessive torque, things like that, then you're going to have less stability in that joint because it's not being held in there by that negative pressure. Similarly, a lot of the times when we see labrum problems, we're going to see impingement of the hip as well. Impingement can come from two different things. It can either come from pinching of the labrum itself. So if you have a small tear in the labrum, things like that, then as those joints move within the pelvis and the hip, it can compress down on the torn part and it can cause excess pain. But if you can also have excess bone around the edges of the rim in the hip and in the pelvis area, if you have excess bone, then sometimes increased mobility, say if your hip normally sits like this and then suddenly there's extra bone across the surface, suddenly where you were able to move all the way up, now if you try to move in that direction, you're going to have you're not going to be able to move in quite the same way, and it's going to hit a lot sooner and cause shearing, pain, just from the compression of that area. Lastly, again, I want to also hit on that muscle activation. In the lower back, I talked frequently about the core muscles and the back extensors. In the hip, you'll have a couple other things as well. So you'll have the back extensors and the core, but you'll also have a lot of muscles surrounding the hip. You'll have hip flexors across the front. You're going to have hamstrings, hip abductors, and hip adductors. All these muscles encircle the hip, and if any of them are tight on one side and then weak on another, then we can have excess turning and movement in the hip, which can cause excess pain. So from here, I want to move to a syndrome that I see very, very frequently across all different types of diagnosis. And this is called lower crossed syndrome. So typically what we see when this happens is you'll have weak abdominals and weak core muscles and tight back extensors in the lower back. Typically when we see this combination, we also very frequently see tight hip flexors across the front of the hip, as well as weak glute muscles, hip extensors in the back of the hip. This X of weak muscles and tight muscles can lead to increased muscle activation issues. And if we strengthen the weak muscles and stretch out the tight muscles, a lot of the times we'll see better things coming. Imagine if you have tightened muscles in the back, your back, which normally sits about like this, will have an increased pressure through it because your abdominals are not able to hold them in that correct position. Similarly with the hip. Your abdominals and your glutes are also going to be working together to maintain this position. So even if your core is really strong and your back is still tight, you might have weak glutes down further the chain. So looking at this, I want to do a quick test for all of y'all. So if you have room to kind of get up, check this, I would love for y'all to try. This test is called the pelvic tilt test. And what it tests is the mobility of the pelvis between the lumbar spine and the hips. And it shows the movement in between the two and how well you're able to control the mobility and the stability in that area. All right. All right, everybody. So let's go ahead and open this up. Can everyone see me right here? All right. So the pelvic tilt test, essentially you're getting into a setup position for a golf swing. Now in this position, some people have that excess tightened lower back and weakened core. And in that position, you'll often see the back get a little bit tighter, more like this, kind of extended through that position. This test tests to see if you're able to move the pelvis in and out of that position in the golf swing. Can you raise your belt line from down low here and pull it up here, flattening out the lower back right through here? So going through this test, you'll see two different things. Either you can't move in and out of that position. So either you're stuck in this position and you can't move. A lot of times you'll see just the hips or the upper body extending itself rather than the pelvis itself moving. Another thing that you'll commonly see is what we like to call the shake and bake. And I actually have a little bit of that right here. This is the inability of the body to control the movement within that area. So if you'll see right here that if you extend that lower back into that setup posture and then move through it all the way through, if you have any type of shaking during that movement, it's a little bit of instability or lack of stability, strength, muscle endurance in that area. All right, let's get back to it. All right. So next thing that we're going to talk about is pelvic rotation. As the pelvic tilt is really important in being able to extend the hip and really increase all the swing power that you have, we also see pelvic rotation, and this is really, really big in the golf swing as well. So this is a test of the mobility of the hips and lumbar spine, the ability to control the pelvic posture in the transverse plane. So as you rotate through that golf swing. So stop the show here. So in the pelvic tilt test, you'll see more of that shake and bake position in the sagittal or frontal plane, whereas in the rotational test, you'll see the hips more so move side to side in this direction. Now there's a couple things you have to watch for. You have to make sure you're not just moving your hips side to side, shaking your hips side to side. main important thing you want to see is that the hips don't raise and lower on either side, that they move completely diagonally to the front and to the back in that area without bending, extending the knees, movement of the shoulders at all. You want to see it completely move just from the hips right through here. So the pelvic tilt is going to be really important in the push off in the golf swing as those hips kind of tilt and push through. The rotation is equally as important because as you pull through that swing, the hips must have to rotate back and then rotate through as they move into that pelvic tilt to assist the ball through the swing. All righty. And we kind of already went through that. Let's check it. Let's make sure that anything like there is going on. So if you see any shades of mobility or stability loss, 100% you can email me, ask me questions, anything like that towards the end of the presentation. So next thing we're going to talk about is these exercises. If we have a problem in any of these type of movements, how are we going to correct it? So as we talked about first, mobility is the first thing that you want to correct. So mobility loss can come in the hip flexors and in the back extensors most commonly, but frequently throughout the population, we're also seeing a lot of hamstring tightness and outer hip tightness as well. So we'll kind of look at a couple things like that. These are 3 exercises that we're going to go through first. They're all stretches for the hip flexor. So we're going to step back to this table right here and I'm going to demonstrate. Y'all are welcome to try out as you're able. Alrighty. So the first exercise, let's see, will you open the screen?
Yes.
Okay, I got you. All right. So the first exercise that you're kind of seeing at the bottom of the screen is a hip flexor stretch. I am going to demonstrate it off of a treatment table right here, but you are absolutely welcome to try this off your bed, any type of flat surface that you're able to work through here. So we're going to start sitting up on the edge of the table. If you want to stretch your right leg, you're going to go ahead and lay back down onto your back with your right leg on the outside of the table, pulling your left leg up to your body to help protect your back. You're going to take that right leg and drop it off the edge of the table. Now through this, you should feel a stretch across the front of that leg, and it should help move further and further down. The more stretch you want, the further you move off that table to continue to let it drop. Afterwards, you can come back up, sit back up right there. If you feel like you're not getting a really good stretch right there, there's 2 other ways that you can do it. The first one is going to be in a kneeling position. I would recommend doing it on the floor, but I'm going to do it on the table just so y'all can see. So if I'm going to be stretching the right hip flexor in this exercise, I'm going to put my left leg up so that I'm in a half kneeling position. From this, I want to make sure that I keep my hips tilted forward, so not extended backwards where my back is going to take a lot of pressure. So keeping those hips tilted forward, I'm going to lean forward until I feel a stretch across the front of the thigh right through here and even a little bit into my hip. So from here, it's going to be about a 30-second hold. 15 to 30 seconds is ideally what you'd want to be working through. Any more and you're just kind of sitting stagnant at that point. After that 15 to 30 seconds, rocking back off, coming back down. You can even switch sides in between those. The last way to do this is going to be seated over a chair. And we'll grab this one right here just to demonstrate. So how you'll do it here is a similar half kneeling position, but instead of getting down on the floor, which I know is kind of difficult for some people due to knee problems, things like that, you'll put that leg up on the edge of the chair right through here. And then in a similar fashion, you'll scooch this other leg forward until this one is out behind you. Now, once you get there, you have to make sure that those hips stay tilted forward, like I talked about earlier. You should feel a stretch across the front of the hip, front of the legs right through here. Same thing, holding about 15 to 30 seconds, and then backing off. All right. All righty. Okay. So those are 3 different ways to stretch the hip flexors themselves. We're going to talk about several others throughout. If any of these feel super difficult, challenging to you, and you find that you're not able to feel the stretch in general, you're welcome to shoot me or Gina an email, ask any questions about how to perform. So the next ones we want to talk about are the piriformis and the glutes. Lots of times I'll have people that have pain through the back of the side of the hip. These are really, really commonly due to either the piriformis muscle, which is situated across the back of the hip, or in the glute muscles, which are situated across the side and back of the hip. So these are another 3 ways that you can do stretches right through here, and we'll go through and demonstrate those. So, first way that you can stretch the back of the hip, I'm going to demonstrate on my right side, is coming down onto your back. First thing you'll do, if you're stretching the right leg, is to take that right leg, cross that leg over the left. From there, you can either push that knee down to get a stretch through that outside of the hip here, or you can even reach your hands through, grab hold of your other leg, and pull up and in, and you'll feel it stretch more through the back of your hip right through in this area. Same thing, holding about 15 to 30 seconds, and then letting off. If that feels super challenging for you, or you're unable to lift this other leg, you can also just bring this leg up towards your chest, right like this. Once you get to this position, reach and try to grab for the ankle of that leg and push that knee down so you feel a stretch out through the hip. The last way you can do this exercise, if being on your back is uncomfortable or if you're unable to reach through your leg, is to simply prop your knees up in a seated position like so. If you're stretching the right hip, you're going to reach the left arm through, cross over that hip, right arm behind you, and pull through until you feel a stretch in that outside hip right through here. All right. So, last one we'll talk about is hamstring stretches. Now, this is something that I want to kind of put a disclaimer beside. There's a lot of people that come in telling me they have tight hamstrings, and they actually do not. Weakness and strength can often feel like the same thing almost. So if you feel like you're fairly flexible compared to most people, but they still feel tight, it might actually be a strength deficit that you need to work on. And you can 100% let a fitness professional like me or Gina, anyone like that, take a look at it and kind of let you know what that needs to be. So we'll kind of demonstrate it on here before we do that. So how we'll test a hamstring length is we want to see that it gets about to 90 degrees. So about to 90 degrees is as far as it needs to go. If you're taking your leg and you're pulling it way back towards your head, towards your ears, even past that 90-degree line like I'm demonstrating right there, that's almost too much mobility here. If you can get to that 90 or even a little bit less, that's perfect. That's as much as you should need. The only reason you should feel the need to stretch is if you cannot get to that area and your leg is even lower than that, right through here. If so, then these are a couple stretches you can do to help with that. So first thing you can do is take a loop strap of some kind, putting it over that toe of that leg, laying down on your back and pulling up right through here. Now as you do, you should feel a stretch through the back of the knee, all the way down into the back of the hip right through here. Again, holding about 30 seconds or so, then coming back up. Another way to stretch that area, if the tightness that you feel is more towards your knee and less towards your hip, is being on your back, reaching through, grabbing your knee from this area, and then extending the leg up through the top. Now, as you extend, you'll notice that the tightness gets to be about right through here. And from there, you can add a little bit of extra pressure through here. From here, you're just trying to extend that knee, straighten it as much as you possibly can, holding that for about 30 seconds. The last hamstring exercise that you can do to help stretch it out, if you have very tight hamstrings or if it's uncomfortable being on your back, is off the edge of a table or a bed. So in this position, to stretch the right leg, you'll sit with the right hip propped up, and sitting across the bed from right here. Other leg will be down on the ground to give you a little bit of support. Now from here, you can stretch and reach down towards that toe, and you should feel it stretching across the back of your leg right through here. Same thing, about 30 seconds at a time. When you finish, sitting back up, taking the leg off the edge so that you can release the stretch. All right, so some basic mobility exercises for all of y'all. From here, I wanted to quickly talk about the pelvic powerhouse, which I mentioned earlier. Once you have the mobility in those restricted areas, then the next thing you have to work on is increasing the strength of those areas to be able to control that movement through that arc of motion. Especially if you're putting outside forces on that body, such as swinging the golf club or even just developing a different force. For example, seated stretching right through here, you might feel like you have a lot of mobility, but as soon as you start to go through that swing and that rotational force, you might feel like it's tight again. Being able to control the motion is going to be a really, really big deal, and being able to push off through all of this. So one test that I like to use on this, especially for the back of the hips, the glutes, things like this, is called the single leg bridge. And this is very, very challenging exercise, very hard to get. But how you're going to perform this test, laying on your back right through here. If you're testing the right hip, then you'll be laying down with the right knee bent up. From this position, that left leg is going to be extended so it meets the other side. And from here, arms across the top so you're not pushing and holding here. From there, you have to use the back of the hips and the strength, all of the posterior chain muscles, to push and lift up and hold this position. If you can hold this position for 10 seconds without any type of cramping or any type of dropping of the hip, anything like that, then you're fairly strong and stable in that position. Most people I see are limited by at least some degree in this exercise. But there are a couple of ways that we can help it to get it a little bit stronger. So, correction. First thing I want to talk about is a pelvic tilt. This is going to establish some good core control, and it's going to help establish a little bit of posterior or backwards movement of that hip, so you can get more extension and more control in that position. Now, to perform this exercise, you're going to be laying on your back. Right, like this. Now, typically when you lay on your back, there's a little bit of space that sits right in between your spine and the back. You can see that little bit of space right through here. I'm exaggerating just a little bit so y'all can tell the difference. Now, to perform a posterior pelvic tilt, what you're going to want to focus on is flattening that space, or being able to increase the rotation of those hips forward, like the pelvic tilt test we performed earlier. So in this position, what I'm going to have y'all do is take your hips and think about pulling your belt line up towards your nose. When you do that, you should feel the outsides of the core tighten a little bit, and the lower back should feel like it flattens down into the mat, the table, the ground, whatever is underneath you in this position. You're going to want to hold this for about 5 seconds so that you can get the nice contraction through your core, and then slowly lower off. There's a lot of different ways to be able to progress this exercise so that laying on your back, increasing the tilt and the movement of that pelvis can be translated to a more forceful activity like standing and tilting the hips and pelvis through here, and then combining it with that rotational component of the golf swing and tilting, pushing through in this direction. But this is a good basic to start out with. All right. Next thing we're going to talk about is a little bit more stability, a little bit more strength. So next thing I want to talk about, since we did that single leg bridge test, is bridges. How do you get better? How do you progress? How do I get the back of my hips and the back of my legs stronger than they currently are so that I can hold that and maintain that position? So there's a couple of different variances of the bridge that you can work through to help increase and get to that position. So the first exercise you can use for the bridge is to add resistance, such as an elastic band that we use very, very commonly in physical therapy and in athletic training as well. Now for this band, I'm going to have you wrap it around your feet and pull it up and over your knees right about to this position, right about over that knee joint. Now from here, you're going down on your back like you would be to perform that bridge exercise. And then from here, having you push your weight into your heels and raise your hips up off this table. Now, once you're there, that resistance adds a little bit of extra tension there. So what I want you to do in this position is push out, moving those knees to the side, and it'll increase the strength in the outer hips as well as the back of the hips as you push and lift up. Important thing to remember right here is to maintain that pelvic tilt control in the core that we talked about earlier. If you're able to do that and lift up and hold that position, then you're well on your way to performing a double leg bridge, which is the first step to performing that single leg bridge. If the strength problem that you're seeing is not so much in the outer hip, but more so in the hamstrings, you can use a ball or any type of surface that's about knee high to help you work on this strength. So here, you'll come down on your back again, and you'll pop your heels up on top of this ball right through here. Now from here, what you're going to be doing is instead of lifting the hips, you're actually digging the heels down. So bringing the heels down towards the table, pressing into that ball and lifting through here. So it's a slightly different position, but this actually will target the back of the hamstrings through here and reduce the tension of the lower back itself. If you find that you're lifting solely from the back, you're not going to be increasing the hamstring strength quite so much. You'll actually be increasing the tightness through the lumbar spine. That's why it's very important to maintain that tilt through here and work on digging the heels down into that ball or into that surface rather than strengthening from the back itself. All right, the last one I want to talk about to be able to progress towards the single leg bridge is an alternating bridge. So in this position, coming back down onto your back once again, you'll go up into a plain single double leg bridge, if you will. So lifting from the hips, right down, right through this. From this position to work towards a single leg bridge, what you can do is practice lifting one leg up and lower back down, lifting the other leg up and lowering back down. Now you'll see as we go, one side holds pretty well. You might have one side that kind of drops a little bit and you're not able to hold up quite so much. So doing this exercise, it'll actually tell you a little bit about what side might be stronger than the other, and it'll as well be able to progress and increase the strength on both sides. You can increase the time that you're doing it, or simply just work that power and that strength back and forth between the two. All right. Couple more stability exercises for you guys, this time up and off the table. So to work the outsides and the insides of the hips, we want to be working the abductors or the outer hip and the adductors or the inner thigh muscles. So we'll kind of quickly run through some exercises for how you can do that. So if it's your inner thigh that you want to work on in particular, you'll actually come down onto your side, the side that you need to be strengthened. In this case, it will be my right leg that I'm working on. So coming down onto my side right through here, I'm going to actually take my opposite leg, lift it up and over so that I can keep my balance right through this position. Now from here, to work on the inner thigh of the right leg, you'll take that right leg on the bottom and lift that leg up and in right through here. Now once you go up, you can either hold for 5 to 10 seconds to increase the strength of that muscle in a shortened position, or you can increase load like through ankle weights, things like that, to increase the strength and the power of that muscle as you lift up and then back down through that position. Other exercises that we'll be working through are squats, as well as what I like to call lateral walking, which if anyone in here knows me, you know that this is very, very common in the PT clinic. So for lateral walking, you're going to place that resistance band right around the outsides of the ankles. And then from this position, what I'll have you do is taking side steps. Now, important in the setup position for this is making sure you're setting up in that same position that we've been doing those tests in. So kind of tilted forward, making sure that your core is in nice and tight in that pelvic tilt position, slight bend in the knees, like you're about ready to take a golf swing. Now from this position, you want to make sure those toes are pointed straight forward, so not turned out to the side by any means, and then stepping out towards the side into that resistance, keeping the tension on the band. So out to the side, control that leg coming back in. Lateral walking, you'll continue all the way across. I like to do about 30 steps or so, or about 20 feet, and then coming back. So as you move through this exercise, you're actually working these muscles in two separate directions. One is going to be the contractile tension of the leading leg, pushing out here. The other one is the stability of the back leg, holding your body up as you have that front leg lifted. Once you're down, this becomes the stabilizing leg as you bring that leg back in. The next exercise we'll talk about is exercises that you can use to improve your squatting and improve your hip strengthening and mechanics in that position. So typically through your squat, you're going to want to see that your hips are going straight down, your knees are coming out over your toes, and your chest is staying up. So as you go down, you'll see it moving like this and back up. What this band will do is it'll actually encourage your hips to work harder, pushing out to the sides to keep those knees from falling in as you move here. So that band will encourage you to strengthen the hips out, pushing out, down, and back up. All right. Last couple of exercises I have for you guys. These are going to be more external loads. They're going to work a little bit more on balance, endurance of those muscles, the ability to control that body as they move into and out of positions. The two exercises I want you guys to be focusing on are called eccentrics. They're going to work eccentrically, or increasing the tensile length of those muscles so that they can not only lengthen and stretch out and increase the mobility, but they'll also improve the strength of those muscles as well. So the first ones are called good mornings, essentially because they feel like a great big stretch. So in a standing position, you can either put arms across your chest, arms behind your head, whatever is most comfortable for you. And from that position, you'll use your hips and hinge at your hips as you come forward, keeping your back parallel towards the floor, and then back up. So as you come down here, you should feel a stretch across the back of your hamstrings. And then once you lift up, those hamstrings and those glutes have to work a little bit harder to push you back up to that position. Essentially a larger version of what you do in the golf swing, pushing yourself through that motion. The other one that I want to talk to you guys about is a single leg deadlift. Now this requires a lot of balance and a lot of stability of not only the hips, but also the core and the lower back as you work through these positions. So a regular deadlift, kind of like the good morning that I just demonstrated, is down with those knees slightly bent and then pushing and extending forward. A single leg deadlift, or an airplane as I'll call them, is when one leg stays down, the leg that you want to work, in this case it'll be my right side, the other leg extends out behind you and stays parallel with your body as you move through that arc of motion, controlling your balance, and then coming back up. So from this position, it would look like this. Control and back up. So to be able to do this, it requires a lot of stability of my standing hip, requires the strength of the hip to control it not to fall over to the side in either direction. It also requires the strength and the stability of the back of my leg and my hip to be able to control going down and then pulling myself back up through that position. A lot of balance, things like this are going to be really important as well, as a lot of the times when we're swinging, it's going to be over uneven terrain or even just grass in general. It's a little bit of a change in the normal dynamics that we have over even terrain, which would be like a hardwood floor, carpet, things like that. All right, and I believe that's all the exercises I have for you guys. Other thing that I wanted to touch on really quick is the importance that particular way to go about things, which is called relative rest. So if you get hurt, unless you absolutely can't do anything else, it's really important to not just sit back and do nothing, be stationary, be stagnant, and wait for it to get better. The most important thing that you can do when you have an injury is to keep moving, because it'll actually strain it in the correct way so that it continue getting strong again. The idea of relative rest is it's the act of continuing to use those musculature and the joints in everyday life while being aware of what activities will aggravate the pain and then restricting those. So if I know that I get increased hip pain if I walk for a mile, do I not walk at all? Or do I walk half a mile? I'm still getting the pressure on my body and the increased strength and mobility that I need to be able to strengthen that hip while not pushing past that point of pain to the point where it's increasingly aggravating. The idea is to find where the line is and to be able to go up to it further along without aggravating. Another thing that I wanted to touch on, since I am a physical therapist, is the importance of physical therapy in the recovery process when you do have pain. So if you do have pain, a lot of the times it's really easy to sit back and say, it'll go away, it'll be fine. And sometimes it will, that is very true. But it will speed along the process so much quicker if you know what you can use to get your body back to the point where it needs to be. So a lot of the things we do in physical therapy are exercises, like I showed today, that will increase the length of muscles and increase the strength of certain muscles to be able to support your body when you have problems like disc issues, stenosis, hip impingement, different things like that. When you have certain pains, we can use those muscles, either lengthening them or strengthening them to help support that area so there's no longer pain in that area. Other things that we do include if you have a really tight and stiff joint, then we can actually do a soft tissue work. So different things like massage, things like that, that will help increase the length and reduce the tension during those soft tissues. Most of what we do in therapy revolves around the muscles though. So stretching and then using body weight, or once you're able to do it with body weight, adding resistance. So either resistance bands like we demonstrated today, or putting on external loads like dumbbells, kettlebells, things like that to increase the strength. If you guys have any questions on where to purchase that, any things like that, we do have different options that you can easily find at Amazon, Target, Walmart, TJ Maxx, and across the board. They're generally fairly defined as long as you know the right section to go to and the right people to ask to increase the strength of the different tissues, because it puts resistance across the entirety of that movement. And then free weights, that we call them, are great to increase the strength. But I think that's all I have for you guys. So if you guys have any questions, this is my email account. You're welcome to reach out to me. Send an email if you have any questions about what we covered today. If you have any questions about a particular diagnosis, I'm available at TOC in Lenore City. We do evaluations there, treatments. If you have any questions or having any pain, 100% reach out to me or Gina, and we can help set you up with someone that would be able to reduce that pain there. But as long as there's no pain, it's all about injury prevention. So working through these should be some great ideas for you guys.